What is Ozempic and what is Wegovy? Well, funny enough, they're both one and the same. They are both different preparations of a drug called semaglutide, a drug that suppresses appetite in the brain. And Ozempic is just a lower concentration dose of semaglutide than Wegovy. Now let me start with Ozempic. Ozempic was actually used to help diabetics control their blood sugar. And a side effect of that was that they lost weight. Now, one of the great things about Ozempic in diabetics is it actually reduces the risk of a heart attack and stroke. It reduces the mortality associated with being diabetic and having furring of the body, furring of arteries in the body, to be more specific, that could affect the blood supply to the brain, create stroke, or the heart have a heart attack. Now, you'll have heard a lot of individuals in the public media are actually paying for this once-a-week injection in order to lose weight, and it's very effective. But it's only effective until you stop taking it, and then the weight will come back on. The other problem with Ozempic, semaglutide, is it does create side effects. Nausea, vomiting, abdominal pain, diarrhea. It can create back pain. And there are two main contraindications to their use. One of them is if you've ever had a history of pancreatitis, inflammation of the pancreas. And if you have a history of thyroid cancer or a family history of thyroid cancer, and specifically actually the less common form of thyroid cancer called medullary carcinoma. Now, the evidence for this comes from, unfortunately, rat models. I'm not necessarily a supporter, but these drugs will never get to the human being until they've been tested in animals. But we've not really seen this in humans. But of course, we've not been using the drug long enough to know this. So that's Ozempic. It's a diabetic drug, great for diabetics, reduces the risk of a heart attack and stroke, reduces the mortality associated with being diabetic when it comes to things like heart disease and stroke. Ozempic is a low-dose concentration that is also being used in individuals privately, particularly in the US, to try and help them lose weight. It has side effects, has contraindications. You must be aware of those. Wegovy is an important drug in the UK now because NICE have just licensed its use in patients with a BMI of 35 or above. So if you're obese and you're struggling to lose weight, and particularly if you've got other morbidities like you've got underlying heart disease or you've got diabetes, then it's very likely that your GP will be able to prescribe for you on the NHS Wegovy, a higher concentration of semaglutide. It will suppress your appetite. It will allow you to lose weight. Now, there are some specific criteria that also need to be met as part of a multidisciplinary approach to helping you lose weight, like, for example, dietary control, as well as the drug itself, and also an understanding of what the drug means, counseling against side effects, and various other matters. And of course, again, if you have got contraindications, such as a past history of pancreatitis, or you have a history or a family history of thyroid cancer, then you probably will not be prescribed this drug. Now, one of the other limitations of this drug, of course, is that it will only be prescribed for 2 years. And it's very likely that after that period, you will gain weight. And that's why it's so important to help counsel those individuals with high BMIs who are going to be on this drug, how to keep the weight off, because you will not necessarily be on this drug lifelong. So I hope that's helped clarify the confusion about Ozempic, semaglutide, and Wegovy, higher dose semaglutide, and its side effects, its effects, its good things and its bad things. Now please subscribe to the channel. There's more to come on this particular topic and lots more, all designed to help you keep heart healthy and prevent you from having a heart attack or a stroke. Bye for now.